Good afternoon in Africa and good morning in the US, and welcome to the 6th Africa-US Forum for 2024 on Population and Development on the 30th anniversary of the International Conference on Population and Development, with African experts with us to discuss what the next 30 years is going to be like. These monthly programs feature speakers from around the African continent and from here in the US. This forum is on the record and is being recorded. Video will be available later on demand on the USC Africa US website, where you can also see videos of all of our forums and also the schedule of all of these programs for the entire year 2024. Our next forum will be Monday, July 29th at the same time, and the topic will be choices facing South Africa's new coalition government. Later this week, you're also invited to join us for a two-day conference on Wednesday and Thursday on Africa, artificial intelligence, elections, and the future of democracy. These monthly forums are presented by, in alphabetical order, the African Center for the Study of the United States at the University of Witwatersrand in Johannesburg, and Bob Keita joins us as always. The Annenberg Center for Communication Leadership and Policy at the University of Southern California, the Center for African Studies at Howard University, the Institute for African Studies at George Washington University, the Public Diplomacy Council of America, and this month we welcome a new partner, the USC Institute on Inequalities in Global Health. Following today's forum, IIGH will convene a new series of programs on Africa and health, and you will hear more about all of that as it develops. We begin today, as always, with our co-convener, Bob Keita, USC Annenberg's inaugural Africa Fellow and Director of the African Center for the Study of the United States in Johannesburg. Bob, good afternoon.
Good afternoon, good morning as well, and glad to be here as usual. I mean, it's now tradition. I do notice that my colleague, director of the Center for African Studies at Howard University, Professor Krista Johnson, is also here with us virtually. I believe we've, as mentioned by Adam, held these monthly events since December 2022, after we came together, as the institutions mentioned, to seek means and ways in which universities, scholars, but also people from think tanks, research organizations, and the policy community could work together to expand our understanding, deepen our knowledge of Africa-US relations. We've touched on many, many topics over the months that have gone by. But today's topic is particularly special because, as you know, the continent, I think it's not news to say that the continent is the youngest and is growing even younger. And the normal statistics are that the continent will be 2.5 billion people in 2050. As of today, we have nearly 225 million people in Nigeria. So America, be forewarned, Nigeria is coming and it will overtake you perhaps soon. We have over close to 130 million people in Ethiopia, 112 people in Egypt, 102 or thereabouts in the Democratic Republic of Congo. And countries such as Tanzania, Kenya, South Africa are also bridging, they're coming close to 100,000 million plus. And of course, as we know, the median age on the continent is 19.5 years. This has come with many challenges. We've touched on this in various iterations under our digital technology and digital transformation domains. We've touched on those through the political and economic engagements between Africa and the US, the economic domain and so forth. But I believe today we have the real experts, so that they will help us understand what 2.5 billion people by 2050 means. They'll reflect with us on what 30 years means, the world of 1994 and the world of 2024. So I come from media and geopolitics. I cannot pretend that I know these matters better than the speakers who are here today. And so I believe I'll hand over to the moderator to take us there so that we learn together. And thank you very much.
Thank you, Bob. And For opening remarks, we have Professor Laura Ferguson from USC in Los Angeles, where it is very early in the morning, but she said she was awakened by Mother Nature with a wake-up shake at 5 in the morning Pacific time. Laura is an associate professor of population and public health sciences at USC, where she is director of research at the USC Institute on Inequalities in Global Health. And she directs the program on global health and human rights. Those of you who are here in Washington have her full bio, and we'll put a link to it in chat. So Laura, the floor is yours.
Thank you very much. And good morning, good afternoon, good evening, everyone. It's such a pleasure to be here with you all for this webinar on African perspectives on 30 years of the International Conference on Population and Development. As Adam mentioned, this is the first event in a series on the future of Africa's health, with upcoming events on population and aging and on One Health. And the Institute on Inequalities in Global Health is very proud to partner with the USC Annenberg Center for Communications, Leadership and Policy and all the other partners, adding a series on health to the prestigious US-Africa Forum. So it's a real pleasure to be here. So the International Conference on Population and Development, or ICPD, was held in Cairo in 1994, and it truly transformed global thinking on population and development issues, and it placed people's dignity and rights at the heart of sustainable development. And very importantly, it affirmed that inclusive, sustainable development simply is not possible without prioritizing human rights, including reproductive rights, empowering women and girls, and addressing inequalities, as well as the needs, aspirations, and rights of individual women and men. And in 1994, at the event, 179 governments adopted the ICPD Program of Action. 20 years later, at a moment of reviewing progress on this program of action, the Addis Ababa Declaration on Population and Development was adopted by African ministers of health and endorsed by heads of state, and built around 6 pillars, including dignity and equality and health, to name just 2 of them. This declaration aims to build on the ICPD and to provide region-specific guidance on population and development and implementation of the ICPD Program of Action. So that's the historical setting. But today, these documents, particularly the ICPD Program of Action, remain the touchstones undergirding work in the areas of population, development, and sexual and reproductive health. And I think it's important that in the 30 years since the ICPD, there have been major advances with significant impacts on national law and policy, program development, service delivery, and ultimately people's lives, right? So across Africa, we've seen increases in life expectancy, decreases in maternal and child mortality, and increased access to some sexual and reproductive health services. And we should celebrate these successes. They are by no means small. And we must also acknowledge that there's still a long way to go. The political opposition to sexual and reproductive health and rights that was evident when the ICPD Program of Action was negotiated has certainly not dissipated over time. In fact, new challenges have emerged, ranging from outright resistance to ideological attacks against gender equality, sexuality, reproductive freedom, and self-determination. And the world has changed in other important ways too. New opportunities and challenges have emerged relating to population dynamics, climate change, and technology, to name just a few. And seemingly, of course, global geopolitics shapes all of our work increasingly. So this is the broader context within which Africa, the world's second most populous region, as Bob has already mentioned, the world's most youthful continent with a median age of just 19 years, and the region with the fastest growing population, continues to work towards fulfilling the ICPD Programme of Action. And let's not ignore the fact that Africa's young people today can expect to live longer lives than at any time in history, and that the aging population is also already growing. Obviously, this is all good news. It also has implications for sexual and reproductive health and rights moving forwards. Now, even as I may not need to do this with this particular audience, before I turn over to our wonderful panel, I want to remind us all of the diversity of Africa. We're talking about 54 countries with thousands of languages, each reflecting a rich culture. And each country has a unique history and geography. Each has its own laws and policies that, alongside local cultures, shape population and development within its borders. And each manages its own health, education, and legal systems. So the challenges and opportunities for implementing and going beyond the ICPD Programme of Action vary enormously between and within countries. So it feels as though it has never been more urgent to learn from one another so that we can strengthen our work across the continent to ensure that rights and dignity remain at the center of sustainable development efforts for the 30 years ahead and beyond. So this panel brings together an amazing set of speakers to do just that, many of whom we at the Institute on Inequalities and Global Health have deep partnerships with going back many, many years, and it is such a pleasure to see everybody here together. So without further ado, let me hand over to our moderator, Professor Jonathan Cohen. Professor Cohen is the Director of Policy Engagement for the Institute on Inequalities and Global Health and Clinical Professor in the Division of Disease Prevention, Policy and Global Health at the Keck School of Medicine. Jonathan, over to you.
Thank you. Thank you very much, Dr. Ferguson. Thank you all for being here. And again, a very warm thanks to our colleagues at the Center for Communications, Leadership and Policy, the African Center for the Study of the United States, and all of our co-sponsors of this event. And thank you to all of you for being here. I do want to add that here at the University of Southern California, we are also fortunate to be joined in Washington, D.C. by two USC medical students who are our inaugural Global Health Summer Policy scholars who are at the table with us. And it's wonderful to see the inauguration of two programs, both this event series as well as our Summer Policy Scholars Program happening on the same day. We have, as Dr. Ferguson said, a truly exceptional panel, as well as an exceptional audience with whom to explore the issues that have been laid out for us. We have provided a full link to their bios in the chat, and they are available in print for those of you in Washington, D.C. So I won't read the entire biography of each speaker, but I do want to give you some highlights just to give you a sense of the depth of expertise and diversity that we have to discuss this issue today. Leading off in our discussion will be the Deputy Executive Director for Program at the UN Population Fund and Assistant Secretary General of the United Nations, Diene Keita. Diene Keita is, as I mentioned, UN Assistant Secretary General, Deputy Executive Director of UNFPA. She also recently served as Minister for Cooperation and African Integration with the Republic of Guinea. The Assistant Secretary General began her career with the United Nations in 1990. She has held many, many leadership roles within the UN system, too numerous to mention. In all of them, she has prioritized and worked extensively on women and youth empowerment, on inclusive growth, demographic issues, sustainable human development, sexual and reproductive health, gender-based violence, and all of the issues that are so central to what we're going to discuss today. We're extremely fortunate to have you here, Madam Assistant Secretary General, calling in from New York City. Thank you very, very much. We also have joining us the Honorable Ben Malunga Phiri, Member of Parliament, calling in from Lilongwe, Malawi, this afternoon. For you, Honorable Ben Phiri is the chairperson for sexual and reproductive health rights for the recently formed Southern and Eastern African Parliamentary Caucus, which we'll hear more about today, which includes 19 member countries and focuses on expanding access to healthcare, promoting education, lowering infant and maternal mortality rates, preventing teenage pregnancies, managing population growth, and promoting sustainable development. He also previously served as Minister of Local Development, or Local Government rather, and Rural Development in Malawi, and was an executive assistant to the 4th President of the Republic of Malawi. And you can read more about his other leadership positions and his diverse career in the bios. Thank you so very much for joining us today. And last but certainly not least, our third speaker is Lilian Maria Wambui, calling in today from Nairobi, Kenya. Lilian is a program officer for advocacy coordination at Amref Health Africa, which I'm sure many of you know is the largest Africa-based international non-governmental organization. At Amref, Lilian oversees the Youth Power Hub project, which is a youth in action regional program spanning 21 African countries in East and Southern Africa. She has more than 14 years of experience in the health and private sectors and a strong background in project management and administration with a focus, again, on youth empowerment, gender equality, and women's leadership. And you can read more about Lilian in the bios on the table and in the chat as well. Lilian, thank you so very much for joining us. So the way this is going to work, I have the honor as moderator of posing a series of questions to our panelists. I'm going to begin with a couple of questions for all of you, just so we can have a sense of the diversity of perspectives that you bring to this topic. I'll then have 1 or 2 follow-up questions for each of you. We'll then move to some Q&A. If those of you who've called in or are at the table have some questions, I'll turn it back to Adam Clayton Powell III to moderate that, and then we will return to the panelists for some concluding remarks. So let me ask all of you an opening question. And Madam Assistant Secretary General, I'm going to turn to you first. So as we know from Dr. Ferguson, 30 years ago, the International Conference on Population and Development put sexual and reproductive rights at the center of sustainable development. In your view, where have the greatest gains been made in the last 3 decades in sub-Saharan Africa? And where is there still a need for progress? Over to you, please.
Thank you so much, Professor Cohen. And thank you, Dr. Ferguson, and to all USC. It's a privilege to be with you today. I wasn't supposed to be on this line. I was supposed to be away, but I came back earlier just to make sure that I can attend this webinar. Thank you for having me. ICPD today in Africa, I think has been, we have progress. We have seen progress. And I think that's the most important thing. And it is relevant for the continent today. Last year, when the African Union Commission, in collaboration with us and with the UN Economic Commission for Africa, organized a continental review of the 10-year implementation of the Addis Ababa Declaration Laura spoke about a little bit earlier. It was a great success. And that framework to implement the program of action provide guidelines, commitment, and targets. For the Africa we want, let's say from now to 2063. So the assessment of all those country reviews from 50 country made reviews. Out of the 54, we got 50 reviews. And it tells a story of the continent's incredible progress over the past 10 years. We have reduced poverty and reduced gender inequality, reduced maternal mortality, improved birth attendance by skilled personnel, reduced child mortality rates, improved school enrollment for both boys and girls, improved governance in many parts of the continent with more active participation of civil society organizations in the political place. And we have improved availability and use of data for national development and increased connectivity. Of course, that's all the good part of it. But as I think our keynote speaker said at some point and gave statistic on population, if I take only DRC, we haven't had a census in DRC for the last 40 years. So whatever we might be doing, we're just extrapolating. So there is need a progress? Oh yes, definitely. We need a progress because not only these gains are important, but they are vastly unequal and showed by the COVID-19 pandemic, conflict, climate crisis, and other mega trends that are swelling in number and impact across the continent. So this is the thing that's very, very important. And in response to those global challenges, of course, and what needs to be done again, we have seen an important shift in the wider global health architecture in Africa. We have a strong unified voice under the banner of New Public Health Order for Africa. Of course, with the Africa CDC and the African Medicine Agency focusing on building local manufacture, progress will be made. But maybe, I don't know how long I have to speak on this, but let me say a point that is very dear to my heart. Inequality. What needs to be done is to make sure that inequality are being tackled. We have been talking and we have been reaching out to the most easiest population to reach out. The further away communities, the local communities, how to get there, how to make sure that, you know, the medical personnel, the health personnel can reach out in their local languages, in the local community. How do we get to the last mile the right way? For me, that's the most important thing that we need to look at as we move forward, as we need to get to the SDGs. Since I don't have the time I have, I'll stop there for the time being. Thank you, Professor Cohen.
Thank you, and we will be coming back to you shortly and look forward to more discussion about the changing global health architecture on the continent, the inequality issues, all the things you just raised. Thanks so much. Honorable Ben Phiri, what perspective would you bring to this question of progress and gaps that I opened with?
Thank you very much to begin with to you for this opportunity and for all panelists and members who are listening to us this afternoon. As a politician, I am looking at this matter as a matter that sits between development, which is what we stand for, and the people. I must be quick to mention that when politics meets science, then we begin to talk. Because previously, before the ICPD program of action, you'll find that data and science evidence were available only to demographers, scholars, and others. And then ministers would just come ceremonial to a meeting and then sign declarations that were never adhered to. But I can assure you the ICPD has this far made a lot of progress. As already highlighted too, you will find that as we speak right now, different methods of family planning, in this case, contraceptives are in access. You go even right in the villages where we represent people, you find that contraceptives are readily available. A thing that was never there before. I can assure you that we have seen progress that was never before. That would have not have happened. For example, the introduction of others call it life skills education. Others call it sexual reproductive, comprehensive sexual education in schools. We are talking about primary schools here, where kids are able to access information to do with sexual rights and reproductive health. That is progress. We have seen laws being outlawed, archaic laws that prohibited quite a lot in most of the countries have already been outlawed, and new laws have come in place. That is progress than ever before. We have seen as well a reduction in both maternal and deaths because of the introduction of skilled laborers within the hospitals. So you will find that unlike before, where we did have traditional maternal workers, right now we've got very well educated and skilled ones who knows exactly what they're doing. As a result, a lot of deaths have been indeed been reduced. So we are doing very well. Most of them have already been mentioned, but probably I could quickly go to gaps. What gaps are there as we speak right now? Probably popularization remains a challenge. As I already spoke, that we've got commodities. I had a look in different countries, Zambia, Zimbabwe, Uganda, and other places. You find that the rural clinics do have commodities, but then access or uptake to the same is very low. Low, why? Because there haven't been proper popularization, there haven't been proper awareness to the same. Now you will find that the commodities which are costly are just lying down there. Nobody's or very few numbers accessing them because of popularization. The next thing is commitments by government to really fund their own programs. You will find that we make commitments, but those commitments are never adhered to. Oftentimes they will tell you because of financial constraints and others, but at the same time, we've got a challenge of rapid population growth in other nations. I must be quick to mention that I don't get too excited when people discuss fertility replacement ratio, because dynamics are different in other, depending on the continent you're coming from. So you will find that for example, one district in my country, when I was local government minister, I discovered one hospital giving birth to about 55 new babies a day, which requires 55 new babies means one classroom block per day must be constructed. Even if you had all the money in the world, you can't construct a classroom block per day. Meaning to say, we shall forever have kids learning under a tree if this is not well managed. So I'm just giving you as an example of the challenges and gaps that are there. I'll leave it there for now and then get back when time permits. Thank you.
Thank you so very much. So Lilian Wambui, I mean, already we've heard quite a spectacular account of a continent in progress, progressing over the past 30 years with some important gaps. From your perspective, working for the largest health NGO in your region as a youth advocate, how would you assess progress and gaps since the ICPD?
Thank you so much. I mean, I just want to first just begin by speaking about what the two previous panelists have touched on, that as Africa as a continent has made progress, and we really commend that because some of the archaic laws, as Honorable Phiri said, were abolished, and we one of the things that we have we applaud is progressive policies and legal frameworks that have been enacted in Africa, and that's really, really commendable. But coming from a youth angle, we just had an introduction that young people, this Africa is the youngest continent. It really creates unique challenges for us. And when we look at the ICPD plan of actions, there are numerous recommendations for regional governments and countries to really implement different policies. But one thing that we really, I think I would say is a gap is especially in terms of inclusivity and working with young people. So many times young people are left behind. They are not part of it, they're not in the decision-making spaces. And that's a worrying trend. Being a young demographic where the youngest, where we have 19 to 35 years, is our population age set, and we really need to harness their agency. We really need to ensure that young people within this bracket are really part of decision-making spaces, and in terms of coming up with policies that are friendly to them. If it's in terms of health, access to healthcare, their needs are different. So one thing that we really, especially in Africa, really, really need to pay attention to is inclusivity of young people, especially also the ones in the rural areas, the ones who are in the marginalized communities. They need a voice. Those ones who are differently abled. So many times we leave them behind. We do not want to include them in our spaces. When we're going for global platforms in different advocacy spaces, their voices are not heard. So that's a challenge, and that's a gap that really exists right now in Africa. And in terms of speaking to different policymakers, young people don't have access to policymakers, because they're really far in between. But we really need to come up with strategies of how we can bridge that gap, how young people can really work together, not only with policymakers, but also amongst themselves, collectively as a group. It's so important that we really look into that, and as we continue to work to implement the commitments across the region, and as we head to 2030, as we are hoping, to achieve majority of the recommendations that are contained within the ICPD plan of action. So that's my brief take for that. And over to you, Jonathan. Thank you.
Thank you. Thank you all for getting us off to a great start. And just a reminder that we will have plenty of time for questions. I do want to come back to what the Assistant Secretary General referred to at the beginning as these swelling, the mega trends swelling the continent. Dr. Ferguson referred to these as well. And I'd like to hone in particularly on demographic change and climate change, as well as the interplay between the two of them. So, for instance, as Dr. Ferguson mentioned, one of the breathtaking changes that we've seen is that young people, middle-aged people on the continent can expect to live longer lives than at any time in history. The 55 children born every day, the classroom of kids born every day, but have longer life expectancy than they've had in the past. We also know that they are, at this point, unless major action is taken, unlikely to age on a healthy planet. You have all alluded to the fact that Africa remains, relatively speaking, an overwhelmingly youthful continent. My question for each of you, returning back to the Assistant Secretary General first, is what do you think needs to be done in sub-Saharan Africa to ensure that concepts of sexual and reproductive health and rights that are so central to the ICPD program of action remain a cornerstone of policymaking and action to foster sustainable development in the context of these major demographic and climate changes? Back to you.
Thank you very much. I think that's a very central question. And I think Professor Dr. Ferguson framed it very, very well. And I would like to commend the panelists, my co-panelists as well. First, the ICPD plan of action from where I sit, is absolutely central for any sustainable development goals. And just like honorable parliamentarian from Malawi said, he's a politician and, an implementer, if I may put it this way. And there is no other way to ensure that, whatever politics, and when I'm talking about politics, I'm talking about policy for development, policy, financial one, economic one, social one, needs really to make sure that the ICPD plan of action is at the heart of it. If it's not, there is no possibility whatsoever to ensure that the population aspect, the demographic diversity, be taken into account. And you all mentioned it as well, the demographic dividend, whether it is for the young population or for the aging population, the healthy aging one, we need it to be taken into account. As UNFPA, we work on both sides and on both hands of that coin. So if we want to make sure that the mega trends take into account what is happening, really, political decision, policy drafting need to put population at the center of it, first. And second, the most important thing, why is the SRHR, the sexual right, and the sexual health are so important? Because if you are not fine with yourself, with your body, and with what is happening of you, this is the center of life, you cannot do anything else. You'll just be, accompanying the society wherever the society wants you to go. So this 30-year anniversary of the ICPD program of action takes really place at the converging mega trends that are reshaping our world. Of course, we talk about climate change, but climate change has been happening for a very long time now. I've been working in countries, seeing, houses going down, seeing those demographic shifts, seeing urbanization increasing, people trying to get away from very remote communities, try to come into the big cities. And of course, we all know that we have a cell phone everywhere in Africa. But this cell phone, does it make it, have an impact technology-wise in terms of how births are being done in remote places? I don't think so. How the inequalities are tackled? I don't think so. So that's why these trends linked to the mega trends are really impacting the way we live life. And SRHR, the ICPD program, is about how we live life. And that's why, for me, it's important at this stage that all policymakers and all partners in development, like whether it's academias like yourself, ourselves, we need to work together to ensure that we give the right data to the policymakers so that they can move on. I'll stop there. Thank you.
Thank you. I'm reminded of the phrase that which sounds much better in French, that the more things change, the more they stay the same. It's such a different world than 30 years ago. And yet what has not changed is the need to put population and sexual and reproductive health and rights at the center of development. That has not changed in 30 years. Honorable Ben Phiri, how do you see these mega trends playing out in your country and region? And how do you think they affect the ICPD and SDG agenda?
Pointing out that quite a number of things, quite a lot of things would have been done by now if we only had put sexual rights and reproductive health into the framework. But unfortunately, we haven't been able to do that quite a lot. We could probably do better. Now, for me, what we need quickly to do is to do a number of things. One is to take issues to do with population, not just like a healthy issue, but to take it as an economic issue. Why? It is because in planning, economic planning, you will look at the numbers and then plan properly. In other countries where I have checked, you find that the population is under the Ministry of Health. I find that to be very misplacing, and that's why we've got a lot of problems, because by the end of the day, for you to really construct proper primary schools, proper healthcare systems, proper everything, food and everything, you will need to plan, and you can't plan without numbers. Therefore, population is key in terms of economic planning. So countries have got to get down into population and put it within there. And probably let me get down as well to say, when we talk about sexual rights and reproductive health, we are talking about completeness of physical, mental, social well-being in all matters that relates to reproductive system. That therefore leaves no limit. And if we are going to achieve this, we need serious stakes on the same. Now, you cannot as well, on the side of Africa where I am, issues of population are closely related to climate. And I'll give you a vivid example. For example, Malawi, Zambia, Mozambique, we have been hit with a number of cyclones. Cyclone Idai came, Cyclone Freddy came, Cyclone whatever, and so many other cyclones and many other climate effects of climate change. But I'll tell you this, people in Malawi, a land which sits on 1,188 square kilometers, compared to Zambia, which is 3 times as big as our country, shares the same number of population, 19 million people in Malawi, 19 million people in Zambia. The very land that my father and grandfather was farming when we were just a few of us, now I have got my siblings there, grandchildren and everybody. We can't farm on the very land because we will not be able to feed ourselves. But I am expecting that my children's children, that will be their land. Geographically, we are not increasing. We are not doing anything. Therefore, people shall continue to farm along the river banks. People shall continue to farm in the mountains. People shall continue to farm, to do all that they can do. But what is going to happen later? We will have dire consequences in as far as sexual rights and reproductive health are concerned. So I'm saying we need to manage, not to control. You can't control, and we should never control, but we must manage. And my last, but one thing to go is to skill our population. If we cannot skill our population, then we've got a big challenge, because you will be talking about labor. Yes, people are excited that no, we've got huge labor force and everything. You will only get excited when you've got a skilled one. One that can feed themselves, one that can put food on the table, one that can make decisions on when to give children, how to give children on their own without any problem. So for me, I would like to end this by saying policies needs to be aligned to this without any biasness, without any fail. This thesis of we don't have enough resources, you will never have enough resources. It's a question of planning. Plan well, plan for your people, and things will be better. Thank you very much.
Oh, thank you. And I know I'm not the only one wishing we had ministers of finance in this discussion as well. Lilian, what is your take on some of these mega trends, whether it's demographic change, climate change, how you see them affecting the youth population and the ICPD program?
You know, you began by saying the more things change, the more they remain the same. And that's very true. When we look at Africa, climate change is no longer a buzzword. Before, you thought it was something that was happening in Europe, and that was none of our business. But now here we are. Honorable Ben Phiri just talked about the hurricanes, the cyclones that have happened in his country. I look at Kenya also. Just during the short rains in March and April, it was catastrophic. The rains that came, I mean, it was terrible. We have not experienced such floods in my country for such a long time, and previously before that was an extreme drought. So we do realize and recognize that climate change is here, and we really need to be coming up with strategies and ways of bulletproofing our systems. And if we look at, for example, our health systems, when these catastrophes happen, the health systems are overwhelmed. Young women cannot access quality healthcare services. If maybe, for example, the healthcare system is overwhelmed because everybody is clamoring for the same services at the same time. So we need to invest in that. We need to really work with demographers, policymakers, as the world keeps changing and as the weather patterns are changing and as numbers are growing. We've just talked about how Africa is numbers are really, really growing. So how do we ensure that we come up with, we curate systems and policies that are really going to be resilient in us and meet the needs of young people, young women, you know, at the end of the day, because climate change isn't joking. We need to also ensure in terms of integration of, we need to ensure that we also talk about the intersection between SRHR and climate change, because I think that's something that sometimes flies over the head of, you know, many of us. We don't want to really acknowledge that, but it is really, really a challenge, and it's something that we really need to be paying attention to, because SRHR is our well-being, it's our dignity, you know, it's a human right. But whenever there is trouble, whenever there is a disaster, you know, everything seems to stop. We look about 2020 when we had COVID. What happened during that time? It was really, really evident that our health systems are struggling. And the challenges that we faced then. So if we also add on to issues such as climate change and all these other emerging trends, then we are really going to be in trouble if we do not really pinpoint and say that we really have to urgently address this as we continue to move, you know, to the next decade, as our numbers continue to grow and continue to swell. So in terms of that, we really need to look at the intersection of climate change and SRHR and ensure that the policies and the interventions we put in place are sustainable for our population, for the young, for the youth across the region, for purposes of sustainability. Thank you.
Thank you, Lilian. We have an opportunity now to delve a little more deeply into some of the specific areas of expertise of our diverse panelists. And I want to come back to ASG Diene Keita and ask you a very important question related to the ICPD program of action and its anniversary. Recently, of course, the United Nations held its Commission on Population and Development. Your agency, UNFPA, played the leading role in that. It must have been an extremely busy time for you and your staff. Among the many, many things that you did, that you hosted, that you led, I want to ask you about one of them, if I may. So along with a number of partners, including the World Health Organization, the Men Engage Alliance, Queen's University in Belfast, you held a side event at the Commission on Population and Development titled Shared Research Priorities for Engaging Men and Boys in Sexual and Reproductive Health and Rights in Accountable Ways. And I wonder if you could share with us some of the outcomes of that event and why you and your agency feel that it's so important to engage men and boys in issues of sexual and reproductive health and rights.
Thank you so much, Jonathan. If I may, to go redirect myself a little bit. One, I found your panel and this webinar very interesting because I had the privilege, being the head of the program, to go to the 5 regions to make sure that, whatever ICPD is happening, I can see it through every angle. So while Africa was celebrating the 10th year, Latin America, the Montevideo Consensus 10-year, Europe was a fantastic experience as well. You know that Europe includes the US, Canada, and Israel. And of course, Asia was celebrating the 60 years of population and development agenda. So it gives you perspective on what is happening other places to make sure that we can work together differently. So thank you for reminding us that, because doing that allow you to see to make Africa and understand what is happening. And in New York, we had a specific African session as well with the countries. Now, that specific panel, the side event you're mentioning on Men Engage Alliance we had was an important one. The purpose, of course, was to discuss and reflect on the study, masculinity and sexual reproductive health and rights, global research priority, etc. Now, I think that was a critical event for me. I loved it very, very much. Why? Because, by challenging restrictive ideas about masculinity and what it means to be a man, new spaces and opportunity are created for women, men, girls, and boys together to make sure that we shift the harmful social and gender norms driving gender inequalities, including gender-based violence. So that event, the purpose not only was to reflect and discuss, but to follow up on this, it was as well to make sure that all our partners working with us are exploring how we can better work together on positive masculinity going forward, and including in rolling out research, documenting good practices, and exploring programmatic entry points. And on our future work to be more practical on engaging men and boys to achieve SRHR together and eliminate the gender-based violence. I'm mentioning this because now we have head of state are championing the positive masculinity at the African Union. But what I want is for them to go forward. The convened term, a nice one, very politically correct one, that will not make it. I want them to be more engaged. That's what we work with them now. And UNFP is the focal point for that, to make sure that they engage and they express themselves. Because if we don't do that, it will just be talk, theoretical talk in meeting room. It will not move forward. We look forward to seeing effective plan engaging men and boys in all our program countries, not only in Africa, but everywhere else. I'll stop there.
Thank you. Thanks so much. And your comment at the top about the regions learning from each other and having that global view is so important, and such a great lead-in actually to the next question I have for Ben Phiri, which has to do with an opportunity that you recently had for parliamentarians from around the world to learn from one another. You attended, I believe, recently the 8th International Parliamentarians Conference on the implementation of the ICPD Program of Action that was in Oslo, and parliamentarians from around the world issued a declaration confirming their commitment to upholding universal sexual and reproductive health and rights. I have a number of questions. I'm curious, following the ASG's remarks, what African parliamentarians such as yourself learned from parliamentarians in other countries. I'm also curious about how, in a similar vein, how did that declaration resemble or differ from the outcome of the African Regional Conference on Population and Development? And what are the advantages and disadvantages of having both of those? Over to you.
Thank you very, very much. I appreciate once again. And I must say that Diane is really doing a good job. I must commend her. And it is very, very important, before I get to my question, to encourage her to say, when you involve men in this discussion, then you are driving towards victory. I am a man, and I must say that 18 years ago, I decided to do vasectomy on my own with my family. We are good. My wife has got no problem of choosing which sort of family planning method she's got to use. So I am good. And men, I am a leader in Africa when it comes to men involvement in this discussion. So you're doing a good job. Keep it up. Getting back to the question that I have been asked, both the Oslo and the African Population Conference Declaration are one. The difference, though, would be the domestication. When we met in Oslo, there were discussion was, there have been so many commitments that have been made by governments. And when I say government in this case, I am not talking about ministers and permanent secretaries and others. But members of parliament who makes the law, members of parliament who does the budgeting, members of parliament had no idea of these so many things. As a result, when it comes to outlawing or making laws in parliament, they were not part of the same. So the Oslo meeting brought together members of parliament and the declarations were made. And I must say, we decided that we're going to domesticate the very Oslo declaration, but by bringing in the touch of Africa. So we brought that back home here. I'll give you a good example of where we are failing. For example, just last week, we learned from the report that most of the countries in Africa are off track in achieving the SDGs, goals by 2030. Why? It is because commitments have been made at different levels, but they have not been contextualized. They have not been domesticated to Africa to make sure that at an African level, how do we handle this? How do we handle this? For example, again, you will find that issues of comprehensive sexual education, it is a taboo to talk about that in Kenya, to talk about that in Malawi, to talk about that somewhere else. How best can we handle that to make sure that we achieve the same goals in Africa as our colleagues in Europe and somewhere else are doing that? So it was important for us to have the African Population Conference, parliamentary conference, to make sure that we look at both the commitments 30 years ago in Cairo, and then look at the Oslo commitments and make our own commitments with our governments to make sure that things are going on well. So I must say that they are the same in a way. The only difference is the African Population Conference commitments have got the African touch. We have now done that, and results of the same. I can tell you that in Zambia, as we speak right now, as I've already highlighted, comprehensive sexual education has now been brought into their curriculum, and they are teaching that. In Mozambique, you will find that contraceptives and other things are being distributed in primary schools. Primary schools are things that would not have happened in Africa. So we have now gotten back together and say, how do we commit? Where do we go? So that's how I would respond on the two. And the question still remains, the financing of our colleagues and the financing of the same in Africa is different, and we thought that it's very, very important that as members of parliament we are well aware and we are doing right things when it comes to budgeting, so that issues of sexual and reproductive health rights are placed within the budgeting system. Thank you. Over to you.
Thank you. Very helpful. And the issue of the economics and planning and budgeting and governance has come up a number of times, and it might be something we want to return to in the discussion. Before that, so, you know, in addition to the regional conferences leading up to the commission, to the parliamentarians conference, we also had a very important convening in Benin, which Lilian, you participated in, which was the ICPD 30th anniversary youth dialogue, which convened under the theme, quote, "A new generation's vision for the future." And this dialogue served as a platform for solution-oriented discussions on the implementation of the ICPD program of action and new ideas for the future. And I'm wondering if you could share with us, before we commence the Q&A, a bit more about the Cotonou Benin Youth Agenda, please.
Yes, absolutely. Yes, so in April, over 400 youth delegates from across the globe convened in Cotonou, Benin, West Africa. And it was a reaffirmation and a confirmation that young people must be part and parcel of the ICPD plan of action. I previously just talked about inclusivity, and during that conference, young people really brought out the blueprint of the vision of the future they would like to have. 30 years ago, we said we began, the ICPD plan of action was laid. And 30 years later, we did talk about progress, but we do know that there's quite a lot of work left to be done. And young people recognize that. That's not something that is beside them. They do know that as much as we have made progress globally, reduction of maternal health challenges, there's, improved access to healthcare, education, but we do recognize there's so many challenges. And young people said, we want to be part and parcel of coming up with the solutions. We just mentioned about Honorable Phiri talked about contextualization, and that's something that is very key that came out in terms of enactment of the plan of action. What may work in Malawi may not necessarily work in Nairobi, Kenya. So young people recognize that yes, there are commitments, and yes, we have made some strides in making progress, but we do need to really address the gaps and challenges that are there. There were 4 key outcomes that came out of the global dialogue, and one of them was education. We look at the impact of education, because we do know when you have a skilled population, you have a population that is informed, that goes to school and finishes school, especially for young girls, because there are communities where young girls are denied their right to education because they are married off at a young age. There are retrogressive cultural practices that also, bring out impact girls' education. For example, they could go through FGM and then they drop off, they get married young, so they stop going to school. So education is one of the important things that we really need to keep championing and highlighting and advocating for across the globe. The power of 1.9 billion. We are so many young people across the globe. Young people are antsy. Young people want to be part and parcel of in the decision-making spaces. I think I have said this before, because so many times young people are not included, and young people have said, no, enough of this. They want to be included in all the spaces of advocacy. I look at my regional program, for example, Youth in Action, where we work with young people across East and Southern Africa, strengthening them to support them to do policy advocacy, working with the likes of Honorable Phiri, members of parliament or policymakers to really address their challenges and their youth identified priorities. So that is something that is also very, very key. The importance of SRHR and well-being is also something else that came out, and also the importance of building a resilient future. We just talked about mega trends and the issues that are coming up. Then we had COVID-19. We saw what it did, the repercussions of that. We're looking at climate change. We need to start talking about these things, and the importance of coming together as a global community, working together, not just as a one-sided coalition, but young people coming together, working with different stakeholders from strategic partners, governments, CSOs, so that we can build the future that we want, so that young people can be able to say, this is what we want for our future in terms of SRHR. These are the issues that we want addressed, and we want our future to look this way. And and just really bringing down the many silos that exist, unfortunately, around us, so we can be able, as a global village, to really come up with progressive, sustainable development solutions for the well-being of young people and for ourselves. Thank you. Over to you.
Thank you, and thank you, everyone. So we're just past the top of the hour, which is, I think, a really good time to move into audience questions. And Adam Powell will assist us with this in Washington, D.C. Those of you on Zoom, feel free to raise your hand using the raise hand function as well. And while you're all gathering your thoughts for questions, I thought we would turn first to Bob Wakesa in Johannesburg. Bob, to see if you have any observations from the discussion so far.
Thank you very much, Jonathan, for the excellent moderation, very great questions, and to the panelists for very effectively engaging with the topic, providing quite a few perspectives that we might have missed out or we take for granted. I think as all the panelists were speaking, I was just reflecting on my own life and realizing that when the ICPD came on board in 1994, we were still very much an analog population on the continent, very much using Pitman typewriters, And now we've gone beyond Zoom. We are in AI era. And I guess that is a good segue into the rise of young people. I think the youth has become a very important topic of discussion today. These are digital natives, as we call them. They did not have to learn many of these things in a computer school or college. They were born with these gadgets in their hands, in their homes, and so forth. And I think an interesting point that came up on board as the speakers were, laying out their points, is that it seems like we are a young continent, but with old leaders, particularly when we talk of issues of governance. I wonder if this is a tricky topic for Madam Diane, given that she's an international civil servant, and for the other panelists as well. But if you look at the fact that we have President Paul Biya at 91, Yoweri Museveni at 78, we have people like Ouattara in Cote d'Ivoire at 78. They might be good leaders, they might be good politicians, but at the same time, we only have perhaps in Senegal, where we had leadership change in April, where we have Honorable Faye, 44 years old. So against the fact that we have a young population and an aging leadership, I wonder if this is an issue that will be of concern in terms of leadership, governance, and so forth. And I say this particularly because in my own country, Kenya, there are, as we speak, very major protests against tax. You can look up that in the media. And the youth there are actually saying it is bad leadership and we should be in the saddle. So this is just a comment. You can feel free to comment, but I thought I will put out that dissonance of young people being the bulk of the population, but not really being in leadership, remaining static at advanced ages. I think the other point that I wanted to discuss was the point that Madam Diane in some exchange and Honorable Phiri also pointed out, which is data and statistics. I was looking at, for example, youth unemployment on the continent. In South Africa, it sits at about 50% youth unemployment. But in a place, according to the World Bank figures from 2023, in Malawi, it is only about 7%. So I was like, are these figures for real? Where we have, youth unemployment figures that some are in single digits, some are in double digits, going to beyond 50%. I think that suggested to me that in addition to the fact that perhaps we are not reaching the rural, remote populations, even to capture them in data, might we be having a problem of data and statistics? Might we be working with wrong statistics, in fact, and what can be done? I suppose I'll stop there and pass it on back to Adam. Thank you.
Thanks, Bob. And I'm collecting these great questions, and we can distribute them to the panelists in a moment. Adam, anyone with questions at the table?
Any questions at the table? Yes, Tammy.
Hi, Tammy Palacios. I'm at New Lines Institute. I was wondering if Madame Keita and Honorable Phiri might respond to this question. When we're looking at limitations in access to rural communities, right? You're talking about implementation of programs. I see two main things that get in the way of that. One, political will and the financing that goes behind political will, and then safety and security of those programs. So if that is the case, I would also be curious if there are other limitations in addition to those two that make it hard for us to access and do programming in these rural areas. But who's responsible for, generally speaking, right? Like, where does that responsibility lie to address those limitations moving forward, in your opinion?
Adam, anyone else at the table, or shall we get a round of responses first?
That may be it for now from the table. Well, there'll be one more. I should have a seat by Jared.
Yes, as a follow-up to the last question, when it comes to programming, how are you utilizing mobile units, medical mobile units, to reach out to your population in the rural areas to make sure that you have a continuation of services?
Great. Thank you. So I see two people on Zoom also have your hands up. So we're coming to you. What I'd like to do is just review the questions we have so far and give each panelist an opportunity to speak to the ones that feel most relevant to you. We had a question that was directed at the Assistant Secretary General, but which I imagine others, especially Lilian, might want to comment on, which was Bob's question of this apparent disconnect between a young population and its aging leaders. So I will ask any of you to speak to that. There's a question about whether the data and statistics around youth unemployment are correct. And then there were two questions about access in rural areas. One being, well, whose responsibility is it? And are there barriers besides political will and safety and security? And another related to whether we're using mobile medical units. So you don't all have to answer all of them, but I'll go in turn, starting with you, Diene Keita, please.
Thank you, Jonathan. Thank you. I would like to thank Bob Wekesa for his first point, because I think they were very, very important. About age, this is my perspective. I've been working in development for those years. Age for me is not the most important point here. I'm saying this very cautiously. What is important is the proactivity of action. President of Ghana is 80-year-old. But that's the democratic country. They are working on data. And I think, Laura, you were telling you wish, or Jonathan, to be in a meeting with the Minister of Finance. I was 2 months ago during the spring meeting in Washington, a Chatham House meeting with Minister of Finance around the world as a member of the data group of the UN. And those are how to unleash the power of data within the development. So believe me, everything we're talking here, they heard it from me. So it exists. We are working on it. And it doesn't start now. If I'm not mistaken, Honorable Phiri, we met in Thailand a few years for the 8 billion people. And you did a fantastic presentation. It's just amazing. I was just impressed. So we are working on those data issues for a very, very long time. So how to unleash the right data is what is important. Demographic dividend, whether you're aging or you are young, you need to be proactive and have your act together. Allow me, academia, to say this word that bluntly. Because if you are young, you're not saying the right thing. You just want to be young people, just want to grow naturally. It doesn't make it. You are ruining the life of every young people. And if you are senior, you have your wealth of expertise, but yet you are grounded. You believe, you think about your children, your children's children, then you are the right healthy aging people we need in this round of people. That's what I wanted to make on those issues. And thank you as well for Cotonou meeting and for the IPSI one. Whose responsibility? I don't remember the name because it's in the bigger room there. It's the government. It's the government, those who want to take the position, those who want to take the job and want to change the world. I've been in the government, I can say very strongly, it's the government, no one else. You want to work and represent your country, do it the right way you can. You may not succeed onto everything, but if you do the right thing, you can advance. And that I can testify, I think Honorable Phiri as well. That's why we are surviving in other roles today. It's the government. Now, insecurity. I'm going to link the insecurity fact even to the medical mobile unit. Why? Because I think that's one of the great examples to put together. In places like Niger or Burkina Faso today, where some places are difficult to reach because of the insecurity, some of our mobile clinics today, we put in very skilled personnel, but not only to act and help the women, but as well to train in case they're not capable of coming back. We do that in Africa, we do that in Afghanistan, just to make sure that, please, we're helping you, but we give you the little knowledge so that you can help in the village just in case there is no one else. So mobile clinics are evolving today to ensure that they are not only for some specific because of the insecurity everywhere. What are the other limitations to get to the people, to the rural community? First is the transport, local road, and the health system and the school system. So the problem of SRHR is at the heart of development. We all said it very loudly, and it needs to be planned as a central development issue from the Minister of Finance and the Minister of Economy and Planning. If they don't do that, if you don't have a health system in place, you will not get to the people. People will die before reaching out. And of course, the last point I'm going to mention on that one is the availability of skilled personnel. Availability of skilled personnel is difficult. To have a midwife to travel from her village, big village, to a smaller one, how she's going to live there, to where she's going to stay, etc., are issues. And we don't have sometimes medical facilities in area. Take DRC, I've served there. It's just a nightmare to get to some of the place to be reached. Maybe I'll stop there to give a chance to other panelist members to speak as well. Thank you.
Thank you. I actually want to jump in and Lilian go to you, and then I'm going to go to Ben Phiri. And I don't want to, well, I don't want to put you on the spot, but I'm going to. The ASG made a very powerful statement that age is not the issue. Proactivity of action is the issue. What do you think?
She's dead on. She's absolutely correct. You can be young, but if you're just on the couch and you're just an armchair advocate, you can really only do so much. I want to first just salute Comrade Bob Wekesa, who just pointed out, young continent or leaders, young people are tired. They are tired of having old people, old men mostly, making the decisions for the young people, and that's why even looking at my country, they're out on the streets, they are really now being proactive, what Ms. Keita talked about. They are really, really up in arms, and they're tired because they want to see progress. They are tired of the rhetoric. They are tired of supposed leaders saying one thing and not doing anything. And really, this is a crux of the matter. When we are talking about engaging, especially as young people, it's a difficult part. It's the policy advocacy. It's trying to track the MP from Malawi and saying we need to have a meeting, and he's very dodgy. He doesn't want to meet you, and such like these are the things that you will encounter, especially as a young person and especially as young people. But we really must be proactive. We really have to hold our leaders accountable. And now this is where it really comes down to the rubber meeting the road, because this is where it really gets difficult when we talk about maybe policymakers making commitments to saying that they're clinics, and then they're not resourced properly, or medical the drugs are stolen, so sort of things, because we do know these things happen. So young people being proactive, calling out their leaders, engaging them, whether they're calling them out using TikTok. I'm seeing that's really something that's really gaining a lot of traction right now. Young people are moving from TikTok challenges to really policy advocacy, calling out their governments, starting movements and campaigns. I'm going back to Kenya at the moment. We have this, this clamor for a bill right now, and young people are leading it, and that's the action that we need. That's the advocacy that we need. That young people are tired. Young people are fed up of having old people making the decisions for them. So I think the cry and the call is to request our governors, our leaders, include us, hold our hands, mentor, support us, listen to us, make us part and parcel of the decision-making process, and guide us in terms of how we should go, and if we want our views to be listened to, if we want our concerns to be addressed, and then we can see, you know, positive outcomes in terms of sustainable development and life in general. Thank you.
Thank you. Certainly no ambiguity there in response to Bob Whitney's.
Jonathan.
Yes, please. Go
Jonathan,
ahead.
really sorry, but listening to Lilian, I forgot to say something when I mentioned Ghana. We mentioned Senegal as a very good system, but yet they are totally against the SRHR agenda and the LGBTQI+. You see what, just to give an example of balance, they may be good in democracy, but we have a hard time working with them on what matters most. Just wanted to add that, you know, just that balance of young leaders and senior leaders. Sorry for it.
Thank you for adding it. And I think we could ask, can you be good on democracy without being good on the SRHR and LGBTQI+ agenda? It's a really important point, and I hope we have time to come back to the point you raised at the beginning about inequality, which resonates with that as well. Before we go to the 3 hands up in the Zoom, Ben Phiri, any responses from your side to the questions so far?
Thank you very much. And I will be quick because some borders around politics and it's like getting a whale into the ocean. I would speak and talk. But 2 or 3 things to highlight. Number one, I think the question of age, I will join the Deputy Secretary. It does not matter. It's a question of the vision that you have. What vision do you have for the country? Or what priorities do you have? When you're governing, almost everything becomes a priority. You've got competing priorities within the budgets that you have. A good example is to look at, for example, the GDP of Malawi and look at the per capita as well. You discover that bringing in social services into it, which are free, bringing in so much in there, you really have got a problem in balancing the budget to make sure that everything becomes a priority. So it's not a question of age, it's a question of the vision. And usually the vision should be forward-looking. It's not a question of now, but it's a question of years to come, what do you want to achieve? That would be my response to that. Number 2 is the question of political will. Oftentimes, the political will is again entangled in religious beliefs and cultural beliefs and everything. Remember, we are politicians. Being a politician, oftentimes you care a lot about the next election than you do on the development of the country. When you're voted today, your next focus is when 5 years elapse, will I get the next vote? And if I'm going to get the next vote, what should I handle and what should I not handle? Now, if the cultural norms and the religious beliefs are really a greater position, a leader would sit down and evaluate and look at the cost-benefit analysis. So the goodwill may be there, but the conditionalities on the ground. That's why I'm still bringing in the question of domestication, the question of sharing, collaboration between partners. UNFPA has been a very good partner. I must mention, for example, in the African continent, it brings members of parliament from one region to the other, and we share the ideas. What are we doing to bringing in mobile clinics to the rural for them to access services? At the moment, I can say the question of accessibility as required the 5 kilometers in most of the countries now, we seem to be doing better. And the commodities partners, UNFPA and others have made commodities available. The biggest problem at the moment is to break the barriers to make sure that the commodities and the services are being gained. For example, there are churches in Africa who completely refuses their members to go to the hospital. They don't want to go to the hospital at all. So whether there is a pandemic that comes or not, how do we deal with that? As we're looking at the mobile clinics, we are constructing more clinics and others, which is a good thing. Finally, let me address the question of systems, education systems, for example. We are talking about systems that will help the youth understand the context at which we are. Universities must move from 3.0 to 5.0 or 5.0 plus. Unfortunately, most of the African universities are still stuck on 3.0, which is purely knowledge transfer, memorizing to the extent that a graduate gets out of there, all he's waiting for are governments to be created by government. But governments can never create jobs. Government's responsibility is to create conducive environment for business people, for corporate worlds to create jobs. And when they are not there, because the universities have not trained them, equipped them to answer to the growing demands that are there, we are creating a problem. So purely we push the responsibility to the governments because they are the ones who have got to deal with systems. My final point is, what do you want to deal with? Do you want to do people management, or you want to do systems management? For me, put systems, manage systems, and the people will flow, things will be better. Thank you, and give back the floor to you.
Thank you. That is a vision for the future. We have three colleagues on Zoom. You've been very patient. Thank you very much. I'm going to take all of your questions, and then we'll go back to the panelists in the same way. I'd like to begin with you, Felicia Eves. Over to you.
Good morning, good afternoon, everyone. It's a pleasure to be here. I've been attending these forums since last year, and each one of them has just been better than the next. But I would like to go back to Diane Keita to really go back to what she said in the beginning about inequality. And if she could, to go deeper into that, because I've worked in the health equity space here in the United States for many years, even when I didn't really know that I was working in the health equity space. And one of the things that we talk about is the social determinants of health, which is really talking about what are the social implications of health that creates inequalities in health, or for health, and not just access, but what are the root causes that creates health disparities in people who are marginalized. And here in the United States, most everything is framed in terms of race. And while that's not really an issue for Africa, I just would like to know, and for Diane or the other panelists, to go deeper to talk about what are the inequalities that they see that are causing these types of health disparities, particularly for the young people of Africa. We know that, Africa is a young continent. And how are these disparities going to, how are these inequities being addressed to sort of help ameliorate the disparities that are happening in Africa, especially for the young people? So any one of the panelists can address that.
I am so glad you asked that question. Thank you so much. We're going to take two more questions and then do a round with the panelists. Dr. Joanna Dodu, please, over to you.
All right. Thank you so much for the opportunity. And I thank the panelists for the insightful discussion on population and health. And a number of issues have been raised. My issue has to do with youth unemployment in Africa. We are touting the fact that Africa is a youthful continent, and the issue of youth unemployment is becoming a problem. And our politician panelists mentioned that it is not the business of the politician to create jobs, but to create the enabling environment. But the issue here is, how far have they gone into creating the supposed enabling environment to support our youth? The issue of youth unemployment is very important, and it is driving a lot of people out, the highly skilled youth, out of the continent. Those who are remaining must survive by all means. And in surviving, they are doing everything they can, which has implication on health. So my question here is, how do we empower or support the African youthful population to work safely, to secure their safety in the short term and their health in the long term, which by implication will support the agenda of achieving decent work? So this is my question here. How do we support or empower the African youth to work safely in order to secure their safety in the short term and health in the long term, which by implication will help achieve the decent work agenda?
Thank you.
Thank
you
you.
very much for that question. And last but not least, I'd like to ask Evelyn to state your question, please.
My name is Evelyn. I work with Amref as a clinician and program officer here in Kenya. Mine is more of a comment and not a question. I have heard Diene talk about empowering women and girls, but also looking at the boys. And when we look at this issue about social reproductive health, I think there's been a lot of work put on women and girls empowerment here in Africa more, and it's beginning to look like now the boy child is being left behind. And so for me, I was actually advocating for gender equity when it comes to leadership and this policy advocacy and involvement of the youth, because the youth have already told us that there's nothing for them. Without them, they want to be included. And mine is just to reiterate the fact that gender equity also is a social determinant of health that really needs to be put into account, so that at the end of it all, we don't have an imbalance when it comes to these issues of youth leadership, social reproductive health. Because when you look at the girls, who are their counterparts? Who are we telling them to, who are we empowering them against? So it's actually being able to give them the information that they require, and for boys and girls alike, and so that all of them can be at par when it comes to development, policy issues, social reproductive health, and gender equity, if we really want to have that uniform development amongst the youth. Thank you very much.
Thank you. Thank you for your comment. So I'd like to perhaps start by asking the Assistant Secretary General to respond to Felicia Eve's question, elaborating on the point you made about inequalities. What inequalities do you see causing health disparities in the continent, particularly for young people?
Thank you very much, Felicia, for your question. I think it's very important. Of course, we are focusing on Africa here, but your point allow me to go further than the Africa continent, and which is very true. That is, our health systems are really plagued by deep legacy of gender inequality, racial discrimination, and most importantly, misinformation. So that's where, you take really the deep roots of where the inequalities comes. And of course, the one that is very, very obvious we don't mention is poverty. So, and poverty is a big, big part, whether you are in Africa or you are in the Americas or in Asia and Pacific. So for that, poverty is absolutely key. Gender inequality and racial discrimination. It is well known that indigenous people and Black population are more discriminated in some of the region. That go without saying. And sometimes take it very simply, in some of the indigenous area, midwife when they are imported from other city, they don't speak the local language, the local community language. So even if they wanted to help, it's very difficult, very, very difficult. And that's something about the midwife. But what's other thing as well is they have been sidelined by a medical dominated system. In sub-Saharan Africa, when we were working on the task shifting for medical, some medical doctor would say, and I must say that the Francophone word was much more stronger than the Anglophone word. No way, no task shifting. Either you have the diploma or you don't practice. So, you know, those kind of norm, those kind of cultures, and have really impacted very negatively the gender inequality aspect and the women safety aspect. So these are the kind of things we are working on to make sure that misinformation about sexual and reproductive health of people, of marginalized community, is something that is important, that need to be taken, that need to be studied, whether in schools or hospitals. And that's where the problem comes. I don't think the health system can start with the health system. The health system comes with the education system. If you don't have the right educational system to make sure that the population, the skill we need in the country, we work on that, then we are in trouble. So for me, that would be really the first most important thing about that. So if we want to reach the masses, you know, we really need to work on them. You take gender-based violence, for instance, it's very, very difficult if you only take the health part of it, saving life and trying to give, you know, the healthcare that is needed. If you don't take the root causes, poverty, inequality, and other issues that, you know, have to be considered there. And for that, you need the whole society to be working on it. After this, I would like to talk about I think it was the employment. How do we empower young people for safety and the work world? I've been listening very carefully about that. Honestly, if a young people has no job, he will not be taking care of his SRHR, his sexuality. He has no time for that. That's true too. That's today's world, that's true too. But what is the employment? I think we have a responsibility, and state have the responsibility to make sure that academia they have in their country really target the job that is needed in the country. Everybody cannot be a sociologist, a lawyer, a medical doctor. Sometimes you have other function, local function that need in order to meet the requirement or the objective, the goal of the country as well. So this is important. Universal health coverage, we don't talk enough about it. I think if there is any job for young people, the universal health coverage in the country need to be taken care of account to make sure that they are covered in a way or another so that they can move forward in their education. And Evelyn, you mentioned the boy child. This is so critical today. That's everywhere around the world. We have sometimes favored the girl because of, you know, obvious discrimination, but it doesn't mean that the boy need to be left behind, because they need to grow up together to make sure that tomorrow they compose a more homogenized society to make sure that they can move forward together. But again, health will only goes hand in hand with the education system. How far are we investing in countries into education to ensure that young people, the girls and the boy, can grow up together? That's very important to make sure that the employment market is being taken care of. Jonathan, I'll stop there.
Thanks. No, these education issues have been a persistent theme. Thank you so much. Ben Phiri, over to you. Any thoughts on the question of empowering youth, but in particularly empowering youth to work safely, or also the question about inequalities at the root of health disparities?
Thank you very much, and questions that are very mind-provoking. Let me begin with the question of the youth. Whatever the case, for example, the issue of data that was talked about, the youth in Malawi factors in about 51%, and out of those, about maybe 35 or 40% of those are unemployed. The rate is so high. Now, a couple of things that are here. Number one is to understand that there shall always be economic migration in Africa to other regions because of the thinking of greener pastures. It shall always be there. Number two is there shall always be unemployment, a lot of unemployment, as long as our education system remains 3.0 at the university and we don't have skills training to equip our people. Why am I saying this? I am saying it puzzles me big time. Big time, and I'm saying this because of from experience, not from anything else. It puzzles me big time that a university graduates get off the university, stays at home, and all he's waiting for is to get a job. That is not responding to the needs of this world. I believe that graduates must get out of there with entrepreneurial skills to be able to create jobs themselves. And that way, the government now must provide conducive environment for them to flourish. For example, provide soft loans for them to create, to start companies, to get into industries, to get into everything. Unplanned population, rapid population growth results in what we're seeing in Kenya, results in what we are seeing in Malawi, results in what we are seeing across the globe. Now, if you don't have those people skilled, you've got a big, big problem. Now, my point again gets down to issues of commitments to one's country. What sort of children are we raising? Are we raising children that knows how to answer problems, or we are raising kids that only gets answers from yourselves? A good example that I'm going to give you, I have got a couple of kids in my house, university student kids, and I, at some point, brought in a girl who we are distantly related. I took all of them to my farm and he gave them a piece of land to work on. All of them, my kids and all my kids and nephews ran away, but this particular one remained there. Over a period of 1 year, she called us and said, this year I have managed to make in Malawi kwacha about 2 million kwacha profit. When my kids, my own kids and my own nephews have made 0 out of the same. Why? Because my kids have not been trained to answer problems, to come up with solutions. They have been trained in school to memorize, to pass exams. So we must shift, we must do a paradigm shift to begin to train our kids into competence instead of desiring just to answer questions and pass exams. Now, getting to a point of inequalities, yes, they are there. Poverty being one of them, imbalance sort of budgeting being the other, and again the question of not bringing in men and girls. You know, we have preached a lot about a girl child, a girl child, a girl child, and the boys have gotten to a point where now they are saying, okay, we'll leave the girls. Let's see how best this thing will go. So for me, I wish this was a different discussion altogether on politics and the youth, because we will then dive deep into these challenges. For me, I don't take it as an excuse. As long as you have been skilled, as long as you have been educated, you are responsible. No government is responsible for your happiness. You must thrive to make sure that things are all right with you. Now, will we secure the youth that remains? As I've said, we may not secure. As one who's been in government, a minister, I have been at the State House really doing policy. I can assure you it is not easy. But you must, as a leader, if you want leadership, you must prioritize. What do you want? Creation of environment that is conducive is paramount. And the issues of SRHR, very paramount. Issues of health and education, very paramount. If you do that, you will find that it will be very, very easy for you to translate all these into gains and an environment that will help us to flourish. Thank you.
Thank you. Thank you very much. So what I would like to do before we go to Lilian and hear your answer to these questions of inequality and youth empowerment is just put my final question on the table for all of the panelists. And so Lilian, I'll ask you if you wouldn't mind to combine your responses, and then I'll go back to Ben Phiri and we'll give the final word to the ASG before we turn it back to Laura Ferguson for final reflections, and Adam. And you know, my question, I think so much of the panel has been leading up to this question, and it has to do with another upcoming major global process at the United Nations. We just had the Commission on Population and Development, of course, but coming up on the back of the UN General Assembly in September is the United Nations Summit of the Future. And we've talked a lot about the future today. And this particular summit is happening in the context of a fraying geopolitical order. It is meant to bring world leaders together to forge a new international consensus on how we deliver on a better present and safeguard our common future. A very ambitious agenda. This is a once-in-a-generation opportunity. It serves as a moment to mend eroded trust in the UN system and to demonstrate that international cooperation can effectively tackle current challenges, as well as those that may yet be over the horizon. And it is, of course, yet another critical opportunity to position the ICPD program of action for the future. And this summit is happening on the 22nd and 23rd of September in New York City. And in fact, the next event in this series that we're calling The Future of Africa's Health as part of the US-Africa Forum will be tied to the UN Summit of the Future. So in that spirit, I want to ask you each to conclude by reflecting on what do you think needs to happen in the next weeks, in the next months, leading up to September, to make sure we make the most of this opportunity and to position sexual and reproductive health and human rights centrally within the Summit of the Future. And you've hinted at your responses, but we'd love to hear your specific ideas for that. So Lilian, you have the floor.
Oh my goodness, I have very few minutes to combine my responses, and that's okay. I think the time is now. When in regards to the UN Summit of the Future, this is not the time to drop our spades. Between now and September, we really must continue to raise awareness about SRHR. We cannot allow the dignity, well-being of young people, of the global population, to really be swept under the rug. One of the things that UN convenings are criticized for is sometimes they are mere talk shops, and we cannot let this opportunity pass us by. We have to ensure that our messaging is clear, that in terms of SRHR, our well-being, youth inclusion, it must be an agenda that is taken into consideration, that is considered, that is actually enacted, and we must ensure that we discuss the issues of SRHR at such global convening, at such a high-level meeting, that youth priorities are not swept under the rug, that youth priorities are at the top of the agenda during the United Nations Summit of the Future, because as you've rightly said, right now so many things are happening that could be retrogressive to the progress that we have made. And yes, we understand the world things are changing so fast. There's so much crisis, not just in Africa, in Europe, in Asia. But this doesn't mean that we drop our spades, that we keep quiet. We must continue raising awareness, talking about the plan of action, the recommendations that have been put there. We just need to continue pushing and working together, especially also as the CSO space, young people. How do we come together? We must come together. We must address the issues that are really at the heart and center of our well-being, and SRHR is one critical and one poignant theme that must really be addressed at the global convening. One more question about the social determinants of health. And one of this is the economic challenges. And it's why it's so important that UHC is really, really implemented in Africa, because we shall then be able to see a reduction in out-of-pocket expenditure in terms of health, because this is what really is a big challenge for for young people and also for African population is just the high cost of getting access to care, healthcare. And when we integrate and implement universal health coverage for all, then it will reduce the cost and the impact of having to use the out-of-pocket funds to gain access to healthcare. And it goes again to policymakers that they must ensure that health and well-being is at the front and center, and they really create systems and support healthcare systems that can really promote UHC. We look at our education. We need to move from rote learning to understanding and being thinkers. We can't always expect the government to give us jobs. So our education system must also be integrated in a sense that it talks about we have to think for ourselves. We have to create our own solutions. We can't sit and wait for government to make us happy, to give us jobs, because they can only do so much. And even as they work to give us create enabling environments, they need to ensure that they understand sometimes some of the bottlenecks are within the ecosystem of businesses, challenges that sometimes are faced by young people or by Africans when we want to come up with businesses. So we must really also work together and to ensure that we create solutions that are have positive outcomes for all of us, not just for the youth, but for the global population. And we can see a better future. Thank you so much.
Lilian, thank you. And let me take this opportunity to thank you for all of your incredible contributions today. It's just been wonderful having you. Ben Phiri, over to you for final remarks, including on the Summit of the Future.
Thank you very much once again. For me, I am looking at this not to be an academic sort of meeting. Must be a meeting with goals, with deliverables, and it must be a meeting of mind growing. Leaders must meet together and be candid with each other and look at how do we want to approach the future. For me, I am looking at it, science should be involved. Data, this is where now each country's data must work. What sort of future do we want? As you indicated, the more reason why people are saying we've got the older leaders determining our future. I think we must have data that supports the sort of future that we want to create. We have already seen that there is a lot of unemployment, but what are we doing about it? We have seen that there is rapid population growth. What are we doing about it? Do we want to take that as a challenge, or we want to take that as an opportunity? If we venture into industrialization, for example, we will deal away with this so-called unemployment, but it will only be done if we've got skilled labor. So if we venture into areas that will be helpful for the youthful youth and a bigger number that we have, we are going to make it. So I'm looking at this particular conference never just to be a paper conference. It must be a conference that will achieve the results that will be. Otherwise, without resolutions, we have gone into meetings and end up blowing our little resources that we have in Africa and achieving nothing. We are tired of that. We're looking for a conference that will bring tangible goals, and we must achieve them. Thank you.
Thank you, and thank you again for all of your generous, passionate, wise contributions today from Malawi, from Southern Africa. And Assistant Secretary General Keita, over to you. How do we position ICPD within the Summit of the Future?
Thank you so very much, and allow me to thank everyone and my brilliant co-panelists and all of you. Well, today, again, every 2 minutes there is a woman dying somewhere. And over 70% of maternal death take place in sub-Saharan Africa. So an African woman who has a pregnancy and childbirth complication is around 100 times more likely to die than a woman in Europe or Northern America. That's the first point. The second point, Africa is home to some of the youngest and fastest growing population in the world. Bob mentioned it, Lilian as well, the median age is 19-year-old. And to be able to support all this data, a country needs to harness the power of the demographic data. So for us, the Summit of the Future is absolutely a critical opportunity for all of us, wherever we sit, to make sure that we mobilize action to support our common goals. Now, we must remain mindful that the Summit of the Future and its three outcomes, first, the Pact of the Future, the Declaration on Future Generations, and the Global Digital Compact, is not intended to replace the 2030 Agenda for Sustainable Development Goals, but really to complement it. And I hope that the declaration, the pact that will be taken, will really emphasize that. For that, us, UNFPA, with all of you, we will make sure we work together to make sure that this goes through. There is a strong recognition that demographic shift will continue to shape our world and future as we work to build, thriving, inclusive society. Maybe the last point I would like to make is really, we must rethink how we plan population change by enhancing the data system to reach those furthest behind, and to ensure that data is used as evidence-based planning. If we don't use the data, I'm not sure we get there. And we must place greater emphasis on capturing individual human dignity, resilience, social progress, inequalities, such as healthy life expectancy and maternal mortality ratio in our measurement of progress. Thank you for Lilian for being in Cotonou. Thank you for Honorable Phiri for being in Norway. And thanks to all of you for working, researching that population matter. And about the population, it's not just numbers, it's people, So together we can advance our agenda. Thank you so very much. Thanks for having me.
Well, and thank you, and thank you for everything you've shared, and thank you for ending your leave early to be with us. We're so fortunate. Before I go back to Adam in Washington, Laura Ferguson, you started us off. Any quick reflection?
Thank you so much, and thank you to all the panelists for such rich discussion. It's impossible to really reflect in the 1 minute that we have. There are 2 points that I would love to bring out, though. One is the importance of proactivity, vision, and action at all ages, across all sectors, and in deep, respectful partnerships. I think we've heard that time and time again this morning. And the other point that I will bring out is on data. And I say this with full acknowledgement of my bias as a researcher, but data matter. We know there are inequalities, but we don't fully understand who's most affected or in what ways. So we have to strengthen our data. We have to do this working together in all the ways we just talked about. And 2 more points on this. So yes, we do need the data. And number 1, we need to be really careful in how we collect and manage data, particularly in the digital era that we're in. And number 2, and Assistant Secretary General Keita has just said this, we need to use the data to inform action. Data on its own doesn't solve the problem, but we need it to inform action that puts people and their rights and dignity at the center of sustainable development. And again, coming back to something Diene said, action that gets to the last mile in the right way. So I will leave you with that thought, and thank you all very much.
Thank you. And look, any responsibility for not having enough time rests with me as the moderator. And with that, Adam, back to you, please.
Well, thank you, Jonathan, and thank you to Laura, and especially to all of our panelists today for a truly rich discussion. Looking to the future and evidence-based planning, as the Assistant Secretary General just discussed. Let's see, Lilian Wambui, you're still with us. I have a short question for you, which is that I see that you study artificial intelligence at Oxford University and at the US Project Management Institute. How do you expect artificial intelligence to be a factor in your work going forward?
Could you say that again? I missed the last part.
How do you expect artificial intelligence to inform your work or be a tool in your work going forward?
Oh, that's a good question. the world is just changing, and artificial intelligence is here to stay. And in the work that we are doing, especially with youth programming, AI is actually helping us to really curate, resources that we are able to, reach what I would call a last mile. Those young people who are at grassroots levels. For example, we have a bot that we have curated with SRHR resources that young people can use to get hotlines for GBV and get support and anonymously ask questions on SRHR. So AI right now is an amazing and powerful tool that we are using to digitize our interventions. It's helping us in our work, and as we continue to slowly pilot it and disseminate it out, across our constituents, we are seeing just the power of it all when it comes to programming of the bots that we are using. We're able to make it culture specific, and it's really amazing the power that AI has it has brought to us, and especially in Africa. It's in terms of having, information, as I mentioned earlier, regarding SRHR, we can be able to, curate that, in a bot, and, you disseminate it through our young population and be able to say, look, this is in Malawi, this is what is happening, this is what SRHR is. We're able to curate even tools and games using AI just to raise awareness about, different interventions for SRHR, what some of these terms mean. What does it mean in terms of adolescence? What is happening? So we're able to curate a lot of powerful content and information that is really, really reaching the undeserved, the young people who are really, really away from the digital spaces, and we are really excited just to see what the power of AI and what it holds for us in the future as we continue to to understand it as it keeps evolving. So it's something very exciting, especially for the African landscape, and that's why we need to keep working with the researchers, with UNFPA, the different partners, just to really support those interventions, especially as the AI world keeps evolving, and it's now here with us to stay. Yeah, thank you.
Thank you. Going forward, I think that there's not very much appreciation on this side of the Atlantic of how much AI is already being used in Africa. And it's not just the future, it's the present. So with that, again, our thanks to everyone on both sides of the ocean. We return on Monday, July 29th at the same time to talk about the choices, some difficult choices that are ahead for the new coalition government in South Africa. And later this week, Wednesday and Thursday, speaking of artificial intelligence, we have a virtual conference, Africa, Artificial Intelligence, Elections, and the Future of Democracy, with speakers from around the continent. So with that, thank you all for coming. Thank you all for tuning in online, and we look forward to seeing you again soon.